Snow pressed against the glass of Mercy Ridge Medical Center, hiding Denver behind a white blur. Inside, the light was hard and bright. Monitors beeped, wheels rattled over tile, and the air smelled of antiseptic and burnt coffee. Riley Hart pushed a metal cart down the main corridor, with her badge turned backward on its clip. Her scrubs were new enough that the navy blue still held its color. The Mercy Ridge logo on her sleeves still looked fresh, like she had just walked in from another life. At the medication cabinet, she scanned her ID and waited for the lock to click. The drawer slid open on smooth tracks. Vials and blister packs lined up in neat rows. Behind her, a trauma monitor gave a sharp double beep and then settled. The sound went straight through her. For a breath, it was not a hospital tone. It was the end of a flatline in a field tent that smelled like dust and metal. It was a field radio going quiet in her hand. Riley's shoulders tightened. She reached for the nearest box, focused on the printed label, until the letters steadied. The tent faded. The hallway came back. She dropped the box into the top bin of her cart. "You good, Hart?" Jen Park's voice came from behind her. Charge nurse clipboard tucked under one arm, ponytail pulled low. She did not look up from the orders she was checking. "Yeah," Riley said. "Cabinet is just slow." Jen made a small sound that might have been a laugh. "Everything is slow except the people crashing into each other on the freeway. Black ice and bad decisions. Trauma beds are full again." Riley curved her mouth into a small smile. It felt practiced. That was the point. "Anything you need me to grab?" she asked. "Finish the restock, then see who is yelling," Jen said. "Tonight it will not be a short list." Riley closed the drawer and moved on. One wheel on the cart squeaked every few turns, a thin sound that most people tuned out. She did not. She let it set her pace. Outside the waiting room, families sat hunched in plastic chairs, coats still zipped. A boy slept on 3 chairs pushed together. A woman clutched a styrofoam cup and flinched at every overhead announcement. An older man stared at a vending machine like he could will it to change. "Riley Bed 12 Labs?" a nurse called. "On it," she answered. She liked the small tasks. Blood draws, vital signs, warm blankets, clear steps, clean endings. They kept her moving without asking for stories she did not want to hand over. As she walked, her badge swung and tapped her chest. She caught it and turned it back around. Her fingertips brushed the chain under her scrub top, then the metal tag that lay flat and cold against her skin. She pressed it there for half a second, then let go. At the nurse's station, 3 residents stood shoulder to shoulder in front of a monitor. "That is a surgical fracture," one said. "That is a sling and follow-up," another said. Riley set a chart on the counter. "Bed 12 needs a signature," she said when there was a pause. The nearest resident took the clipboard, signed it without really turning, and handed it back. "Thanks," she said. He was already talking again. It was not rude, it was how busy looked. It suited her. People who were running did not stop long enough to wonder about the quiet new nurse who never talked about before. From the ambulance bay came the soft rush of the automatic doors. Cold air slid along the floor, sharp enough that Riley felt it on her ankles. Jen lifted her head. "Incoming," she called. Her tone cut clean through the noise. "Trauma possible, fracture vitals borderline." The paramedic radio crackled on the desk. A voice came through in short bursts. "Male early 30s, training accident at the Navy facility, left arm trauma, severe swelling, hand cold, radial pulse weak and dropping." Riley shifted her cart closer to the wall. She pulled a blood pressure cuff from the top bin and hooked it over her wrist. Habit more than plan. Her body liked having something ready. The ambulance doors opened wide. 2 paramedics pushed a gurney into the corridor. The man on it was tall and broad-shouldered, in a dark workout shirt with a Navy emblem smeared by gray dust. His left arm was bound tight against his chest in thick bandages already soaked through with a dark stain. His jaw was clenched. Sweat shone at his hairline. His skin had that pale, flat look that meant his body had started deciding where to send blood and where to pull it back. The fingers of his injured hand were swollen and too still. "Mercy Ridge patient is Price Logan," the lead paramedic called. "Navy SEAL, indoor training drill, direct impact to the left arm, massive swelling, loss of sensation, radial pulse fading." Dr. Marcus Sue stepped to the foot of the gurney while it was still rolling. He snapped on gloves as he walked, eyes already on the injured arm. "Bay 3, he said. "Move. Gen Trauma Team. Get Doppler compartment pressure kit vascular on standby." The corridor thickened with movement. Residents fell in beside the gurney. A respiratory therapist appeared with a portable vent. Someone cleared a path with a sweep of an arm. Riley flattened herself against the wall and let the current run past. The cart handle was cool under her fingers. As the gurney passed, she caught a clear look at the man's face. His eyes were open, following the ceiling tiles that slid overhead. There was a stillness in them that did not match the rush around him. Not peace, not panic. The look of someone who had rehearsed this moment in his head and knew he might come out missing a piece of himself. His gaze flicked sideways and skimmed over Riley. It did not linger. Her chest tightened anyway. Training shirt, Navy emblem, the word SEAL still hanging in the air. She pushed the reaction down. Mercy Ridge saw uniforms every week. Police, firefighters, security. It did not mean anything. Riley, Jen said. She had already set a metal tray on the counter. Injection kit for Bay 3. Take it in, drop it, and clear out unless they tell you otherwise. Got it, Riley said. Jen slid the tray onto Riley's cart. Glass vials and syringes rattled softly as she turned toward the open trauma bay. The sign above the doorway read Bay 3 in red block letters. The light over it burned bright and steady. Riley pushed the cart forward and stepped into the wash of harsher light. Bay 3 was a box of white light and metal edges. Riley pushed the cart to the threshold and felt the temperature change on her skin. It was only a few degrees cooler, but the air seemed thinner, as if someone had turned down the oxygen just enough to make her lungs notice. Keep his head midline, Dr. Marcus Tsu said. I want a neuro check every few minutes, but focus on the arm. He stood on the left side of the gurney, eyes on Logan's injury. The residents moved around him like small satellites holding equipment, pressing buttons, trying not to get in the way. A portable ultrasound unit sat on a rolling stand by the foot of the bed. The cuff of a blood pressure monitor squeezed and relaxed around Logan's right arm in a steady cycle. Riley parked the cart against the far wall out of the flow. She picked up the injection tray with both hands, careful not to rattle the glass. Set it on the side table, Marcus said without looking at her, and stay clear of his left. Yes, doctor, she replied. Logan's left arm lay on a padded board across his chest, bound in layers of elastic wrap. The skin at the edge of the bandage was stretched shiny and tight. His fingers were thick with swelling knuckles, erased nails faintly blue. A resident ran a Doppler probe over the inside of his wrist. The room quieted for a moment, waiting for the soft whoosh of arterial flow. The only sound was the monitor beeping in the corner and Logan's controlled breathing. Nothing, Marcus asked. The resident swallowed. I am not getting a signal, sir. Marcus did not sigh, his jaw set just a fraction tighter. Check the ulnar side. The resident shifted the probe, pressed again, listened, shook his head. How long since the accident? Marcus asked the paramedic. 40 minutes door to door, the paramedic answered. Impact during close quarters training. He did not say much until the hands started going cold. Marcus glanced up at the wall clock. So, almost an hour with compromised flow. He peeled back part of the wrap with gloved fingers. The swelling pushed against the fabric as if it wanted out. Riley could see faint mottling along the forearm, a bruised map spreading with each heartbeat. Captain Price, Marcus said, voice is even, can you feel this? He pressed along the fingertips. Logan raised his head a little, looked toward his hand, then let it fall back. No, sir. Any tingling pins and needles? Nothing. Try to move your fingers for me. Logan stared at his hand like he was willing it to respond. The muscles in his neck flexed, his jaw tightened. One finger trembled a millimeter, then stopped. That is it, he said, breath coming shorter. That is all I have. The monitor displayed his heart rate in green, 84, 86. His body was trying to keep up. Riley set the tray on the side table, checked the labels against the order slip out of habit. Antibiotic, pain medication, a small vial of a drug to keep his blood pressure in a safe range. Her hands moved without needing instruction. Blood pressure dropping, a resident at the monitor said. 90/58. Increase fluids, Marcus said. Get another line in. I want lab stat. Type and cross for 4 units. Riley stepped back until her shoulders touched the wall. From here, she could see the whole frame. Logan on the bed, Marcus at the arm, residents along the edges, Jen entering with a bundle of supplies. Everyone had a place. She knew what hers was supposed to be. Quiet hands, no opinions. Marcus leaned over the arm again, fingers pressing along the forearm. He looked at the ultrasound screen where the gel and grayscale image showed packed muscle compartments and shadowed vessels. This is not just a fracture, he said. We have massive compartment syndrome. The tissue is choking. Can we do a fasciotomy and save the limb? A resident asked. Marcus shook his head. Not with that much time gone. No distal flow, dense, swelling, dead sensation. We are past the window. Logan's eyes opened. They were a clear, washed-out blue under the bright lights. He looked from Marcus to the resident who had asked the question. Say that in English, he said. His voice was hoarse but steady. Marcus looked at him fully now. The muscles and vessels in your arm are under so much pressure they are not getting blood. When that happens long enough, the tissue dies. So, Logan said, you are saying the arm is done. We can try a decompression, Marcus said, but with the amount of swelling and the absent pulse, there is a high chance you will lose the arm anyway, and we add hours of dangerous surgery before we can address that. If we take the arm at the upper humerus, we control the damage and you live. Riley watched Logan's face. The muscles locked for a second, then relaxed. He blinked once. I am not asking for hero points, doctor, he said. I am asking how you keep me breathing. Amputation gives you the best chance at that, Marcus replied. The word hung in the air like a dropped instrument. Riley knew the shape of that word, even if she had never been the one to say it. She had seen what happened after, the weight of an empty sleeve, the way a person learned to reach with the arm that was not there. Logan swallowed. His Adam's apple moved slowly in his throat. Then I need you to be honest with me. If this were you, would you try to save it or would you cut? Marcus did not hesitate. I would cut. One of the residents glanced at Riley as if expecting her to flinch. She kept her expression neutral eyes on the edge of the side table. The metal was smudged with faint fingerprints from the last code. We will put you under, Marcus continued. You will not feel the surgery. You will wake up in recovery. We will have a rehab plan in place. There are excellent programs for veterans and active duty. You will still have full function of your dominant hand. You assume you know which one I use, Logan said. Marcus paused. Which is your dominant hand? Logan lifted his right hand, flexed the fingers to show how easily they moved. This one. So, that is something right. The attempt at humor was small but real. One of the residents smiled a quick, reflexive twitch. Jen stepped closer to the bed. We will call whoever you need us to call, she said. Family unit, whoever. Logan shook his head once. No calls, no calls yet. Any allergies? A resident asked on pen ready. No. Any cardiac history? No. Healthy as they come. Medications? Nothing regular. He answered like he was giving a briefing. Facts only, no color. Riley studied the left hand again. The bluish tinge at the nails. The strange, heavy stillness of it. When she listened, really listened, she could feel the silence there in contrast to the rest of his body. It was the same quiet she had felt pressing on the artery of a Marine who bled out in the back of an armored truck. A wrong kind of quiet. She shifted her weight, then forced herself to stop. This was not her call. Jen, Marcus said, get consent forms for surgical amputation. Schedule OR as soon as we have blood ready. Page Dr. Briggs, let him know we have a high-risk limb case. At the name, one of the residents looked up sharply. Briggs, as in chief of surgery, Briggs? Yes, Marcus said. This is his wheelhouse. Riley remembered the face from orientation photos. Older distinguished the steady center of every staff rumor that started with the words legend in this place. She had not met him yet. New nurses did not usually cross his radar. Do I get a say in this? Logan asked. You always get a say, Marcus said. That is why I am explaining everything before we move you. If I say no, Logan asked, then we keep you here, treat the pain, and watch you go septic when the tissue dies, Marcus said not unkindly. That is not an option I recommend. The bluntness made one of the residents shift uncomfortably. Jen kept her face calm. Logan stared at the ceiling for a long moment. The bright light washed out the small lines around his eyes. He looked younger when he was not trying to appear unbothered. All right, he said finally. If this is the only way you keep me above ground, then you do what you have to do. Riley felt something tighten at the back of her throat. Marcus nodded once. We will take good care of you. He turned to the team. Prep him for surgery. Foley Central Line, full set of pre-op labs. I want that arm marked and photographed. Document all findings. Orders moved through the room. People peeled away to complete tasks. A resident pulled the curtain slightly closer to the bed for a little privacy. The ultrasound machine squeaked as someone rolled it to the side. Riley reached for the injection tray to step out. Leave it, Marcus said. We will use it here. She set it back down. The metal clinked softly. As she turned to go, Logan shifted his head just enough to follow the sound of her movement. His eyes slid over the room, then landed on her profile. For a second, his forehead creased the way it might, when a word sat on the tip of his tongue and refused to surface. Have we met? He asked. Riley kept her gaze on the doorway. I do not think so, sir. Something in his expression said he did not quite believe that, but he let it go. The monitor beeped on steady and indifferent as she stepped through the curtain and out of the bright square of Bay 3. The hallway outside Bay 3 felt dimmer, although the lights were the same. Riley stood for a moment with her hand on the cart handle, letting the sounds of the trauma room fold back into the larger noise of the emergency department. A phone rang at the nurse's station. Someone laughed too loudly at a joke near the vending machines. A monitor chimed an alarm 2 beds over, and then went quiet again. Heart. Jen's voice snapped her focus back. Riley turned. Jen was already walking toward her, with a plastic tub full of labeled syringes and IV bags. Pre-op meds for Price, Jen said. Antibiotics, a little something for the ride to the OR, blood pressure support if he tanks. Take them in, stay long enough to see they are hung, then bounce. I do not need Shu snapping at me about crowding the bay. Riley accepted the tub. The labels were neat black ink on white stickers, every dose exact. She liked the certainty of them. Yes, ma'am, she said. Jen eyed her for half a second. You look pale. You okay? Fine, Riley said. Oi, Gipis, Riley said. Had a long shift. Jen nodded. Welcome to Nights. Riley turned back toward Bay 3. The curtain was half drawn, a rectangle of bright light spilling under it. She took a breath that tasted like disinfectant and old coffee, then pushed it aside with her shoulder. Inside the room felt smaller. Logan had been moved from the thin ambulance stretcher to the wider hospital bed. His injured arm was still wrapped to his chest. A blood pressure line snaked from his good arm. The ultrasound machine sat unused in the corner, now streaks of dried gel still on the probe. Marcus stood at the computer clicking through chart fields. A resident adjusted an IV pump. The paramedics were gone. Riley set the tub on the side table with a soft plastic thud. Here are the ordered meds, she said. Marcus glanced over. Good. Hang the antibiotic and the fluids. Leave the sedative. Anesthesia will handle that in the OR. She nodded and reached for the IV line. Her fingers moved on their own, unclamping, connecting, spinning the lock into place with a small twist. The antibiotic bag crinkled as it settled into the pump cradle. Name and date of birth, she said automatically. Price Logan, he answered. June 15th, 1987. Any trouble with antibiotics before? She asked. No. She opened the roller clamp. The clear tubing filled slowly with pale yellow fluid. He watched her hands, then her face. You really look familiar, he said, quieter now. Riley kept her eyes on the drip chamber. I get that a lot. From where? He asked. Because it is not from around here. I moved a bit before this job, she said. Hard to keep track. She taped the line down along his forearm, the tape warm against his skin. She could feel the tremor underneath, small, but there. Marcus stepped away from the computer. Price, we are finalizing your labs and getting your blood ready. OR is opening in about 40 minutes. Any questions before we move you? Logan took a breath, let it out slowly. He did not look at Marcus. He was still looking at Riley. You ever flown in a Black Hawk Heart? He asked. Her hand stilled on the tape. Marcus frowned. Captain, now is not the time for small talk. We have things to do. Not small talk, Logan said. His gaze stayed on Riley. You ever ride one out with 3 liters and a medic holding pressure on your chest because your lung is trying to collapse? The sound in the room shifted. The residents glanced at each other. Jen, who had come in behind Riley and was scanning the monitor, looked up. Riley felt the monitor beeps melt into rotor blades in her ears. For a second, she smelled hot metal and the sour insulation of an old helicopter hull. She forced herself to keep her hand moving, smoothing the tape. I do not know what you are talking about, sir. He blinked once slowly. You called me sir, he said. You did that the first time too. Kid with a captain's bar scared out of his mind, and you still called me sir while you yelled at me to keep breathing. Marcus straightened. Captain Price, this nurse just started here last month. Whatever you are remembering, it is not her. Logan ignored him. He lifted his right hand, the one with all the lines in it, and carefully brought it up toward his forehead. The movement pulled at his IV, twisted the blood pressure cuff, made the resident wince. Sir, do not do that, the resident said. You are going to dislodge something. Logan did it anyway. He completed the salute, slow, deliberative fingers pressed palm flat, the kind that meant more than habit. The room went quiet, except for the monitor and the distant overhead announcements. Riley stared at his hand. The skin over his knuckles was scraped a raw line of red. Captain, you really do not need to do that, she said. Her voice was softer than she meant it to be. His eyes shone a little, whether from pain or something else. Ma-am, he said, and the word was careful. You pulled me out of a blown vehicle on Route Sabre northeast of Fallujah. There was sand in my mouth, a hole in my chest, and I was sure I had about 30 seconds left to panic. You did not let me. You slapped a seal on my ribs and told me I was not allowed to die in your ambulance. Riley's throat closed. Her fingers curled around the edge of the bed rail so tightly her knuckles went white. "You are mistaken," she said. The words scraped on the way out. He lowered his hand to the bed. The effort cost him. His breathing hitched once, then steadied. He did not look away. "You called in the bird yourself," he said. "Your call sign was Nightingale." Marcus exhaled in a short, clipped wheeze. "This is absurd. Captain, your brain is under stress, your body is flooded with pain meds, and you are reaching for familiar stories." "I am reaching for the person who saved my life," Logan answered. Jen shifted her weight. The residents kept looking from Logan to Riley as if waiting for a cue no one wanted to give. Riley tried to step back. Her heel caught on the base of the IV pole. She bumped into the side table, and the syringes in the tub clicked against each other. "I am not her," she said. It came out fast like it had been waiting behind her teeth. "Whoever you remember, she is not here." "Riley," Jen said quietly. Riley shook her head once. Marcus rubbed his forehead, then spoke with more force. "Hart is a nurse. A good one, I am sure, but a nurse, not a combat medic, not a surgeon, not whatever fantasy you are building." Logan finally turned to him. The look in his eyes had no fantasy in it. "With respect, Doctor," he said, "you were not there." "We are here now," Marcus said, "and right now we have a dead limb that needs to come off, so you do not die with it." The word dead hit harder than the others. Riley looked at the arm again. The wrap, the swollen skin, the pale fingertips. She could almost see the invisible pressure layering inside muscle against fascia blood, trying to force a path and failing. Her fingertips itched. "Captain Price," Marcus said, returning to the script he trusted, "you signed consent. We are proceeding as discussed." "But you just said the limb is dead," Logan said, "so nobody is trying anything else." "We are beyond the window," Marcus said. "You were compromised for almost an hour. The risk of rescue is higher than the chance of success." Logan returned his gaze to Riley. "You told me the same thing once," he said. "In that alley with the dust and the smoke. You said the risk was bad. Then you took it anyway." Riley heard the helicopter again. She saw the alley the way it had been for years, in her head tilted and narrow and red at the edges. "Stop," she said. No one spoke for a moment. It was not clear who she was addressing. Marcus folded his arms. "The only person taking a risk here is me," he said. "If I do not get that arm off in time and you go septic, I am responsible." "Then be responsible enough to let the person who has seen this in the field look at it," Logan said. He did not raise his voice. The calm in it was worse than anger. "Hart is not qualified." Marcus said. "Qualified by whose standard?" Logan asked. "Medical school or the fact that I am alive to argue with you because of her?" Jen cleared her throat gently. "Maybe she can take one more look at the arm," she said. "We are not losing time by checking, are we?" Marcus shot her a look. "Every minute we stand here debating is another minute of ischemia." Riley realized everyone was now waiting for her to speak. The room seemed to tilt a degree toward her. She heard herself say, "I am not a surgeon." "No," Logan said. "You are a medic who has seen this before." Riley closed her eyes for a second. The inside of her head flickered between two sets of lights, fluorescent white and desert sun. She opened them again. "Give me 30 seconds, she said. Marcus stared at her. "On what planet do you give yourself orders in my trauma bay?" Jen answered before Riley could. "On the planet where 30 seconds is all it takes to confirm what we already think we know." Marcus hesitated, jaw tight. He finally gave a small, sharp nod. 30 seconds. Touch only. No heroics. Then we move." Riley stepped closer to the bed. Her palms felt hot inside the gloves. She rested her fingertips lightly along the edge of the wrapped forearm, then along the inner aspect near where the pulse should have been. The skin was cooler than it should have been, but not the waxy cold she associated with tissue that was already gone. The swelling was intense, every structure crowded against the next. There was a particular kind of resistance under her fingers, a packed, angry pressure. She followed it up 2 centimeters at a time to the tightest point. The monitor beat on. Somewhere in the distance another code was called over the intercom. The world narrowed to her hands and the arm under them. She pressed a little more firmly and felt the faintest give as if something inside tried to push back. She lifted her hand. Her mouth was dry. This did not feel like a dead limb. She looked at Marcus. "Doctor," she said quietly, "this does not feel past saving." Marcus stared at her like she had spoken in a language he did not recognize. "What did you say?" he asked. "Deceased." Riley kept her eyes on the arm. It was easier than looking at him. "It does not feel dead," she said. "The tissue is tight and starved, but it is not gone. You are basing that on what Marcus said, your gut. On what I feel under my fingers, she answered. She pressed again along the forearm, tracing the invisible line of the artery. At one point near the middle third, the pressure pushed back against her. Not much. Enough. There is a choke point here, she said. The swelling is collapsing the vessel, and the fascia is trapping it. The blood is pooling above and trickling below. It has not been long enough for all the muscle to die. Riley, Jen said softly. It was a warning and a question. Do you hear yourself? Marcus asked. We have no distal pulse, dense, swelling, crushed compartments. Every indicator is screaming irreversible. You are feeling your way through a limb that we already know is done. Riley kept her hand in place. No distal arterial signal, she said, does not always mean no potential flow. It can be spasm, collapse, compression. You told him we are almost an hour from injury. That is bad. It is not automatically hopeless. We have imaging, Marcus said. He jabbed a finger toward the ultrasound. We have objective data. We are not in some forward aid station playing war games with pressure injuries. No, Riley said quietly. We are in a level 1 trauma center with options. And we are about to treat his arm like a piece of dead wood, when I do not think it is. Silence rolled across the room in a slow wave. Logan watched her with a focus that made the back of her neck feel warm. His right hand lay open on the sheet, the fingers relaxed now that the IV was secured. His injured hand rested in its swollen stillness. You have seen this before, he said. Riley's mouth went dry. Yes. Marcus scoffed a sharp, short sound. In what setting exactly? Because unless it was under a board-certified trauma surgeon, I am not interested. Her gaze flicked to him. In a Humvee with half its side gone, she said. In a courtyard with broken concrete and a line of bleeding men. In a tent where the only light came from a battery that could run out at any second, with no backup, with no legal department waiting outside. No one spoke. She had not meant to say that much. I did not see those rotations on your CV, Marcus said. His tone was lighter than his eyes. They are not on my CV, she said. Jen looked at her, really looked this time. There was a new sharpness in her expression, as if she was rearranging a memory of Riley holding pressure in a previous code. Logan shifted his shoulders against the mattress. Doc, he said to Marcus, you wanted objective data. There it is. She has done this. You have not. Marcus turned back to Logan. I have done fasciotomies since before she finished high school. Riley shook her head. You have done controlled releases in an OR with time and tools and a plan, she said. This is not that kind of timing. Exactly, Marcus said, which is why we do not gamble on a maybe. This is not the place to improvise battlefield tricks. That word cut deeper than he probably meant. Tricks, Riley repeated. You know what I mean, he said. Off-label, off-protocol, whatever they taught you, wherever you picked that up, it is not standard of care. Logan drew a breath, slow and careful. What are you suggesting, Hart? He asked. Riley kept her eyes on the injured arm. The skin shone under the bright lights. She could feel the heat of the rest of his body contrasting with the creeping chill in the hand. Earlier fasciotomy was not deep enough, she said. The sheath was nicked, not fully opened. The vessel is compressed and spasming. If we relieve the pressure along the correct plane, we might restore flow. Might, Marcus repeated. That word does not inspire confidence. We already know what happens if we do nothing but cut the arm off, Riley said. He wakes up without it. That outcome is set. There is no scenario where his arm goes to the OR like this and comes back attached. She let that sink in for everyone, including herself. So, the choice, she went on, is not between guaranteed success and dangerous experiment. It is between guaranteed loss and a narrow chance at keeping the limb. Marcus opened his mouth, then closed it. He looked at Jen. Where is Dr. Navarro? He asked. I want another attending to sign off if we are going to indulge this argument. She is tied up with the multi-car pileup from 30 minutes ago, Jen said. You are the attending on duty here. Marcus muttered something under his breath. Jen stepped closer to the bed, standing opposite Riley. If there is a way to save the arm that does not cost us the patient, I would like to know about it, she said. And we are burning that window arguing. Riley felt every pair of eyes in the room. I cannot promise the arm lives, she said. I can only say I have seen this pattern, and I have seen it reversed if you act before the tissue crosses that line. In the military, Marcus said. Yes, she said. Under combat conditions, he said. Yes. With training that is not recognized in this hospital, he said. She did not answer. She did not need to. Logan let out another slow breath. Doctor, he said to Marcus, what is the worst case if she tries her thing and it does not work? The worst case is you bleed out on my table before we can convert to amputation, Marcus said. He spoke to Logan, but his gaze dropped to the arm. Or we open a route for infection, or we buy just enough time for you to go septic anyway. So, I either lose the arm now on your schedule, Logan said, or I take a shot at keeping it and still lose it if we miss. My survival odds. Marcus hesitated. If we control the attempt and convert quickly, they do not drop much, he admitted, as long as we respect the clock. Logan looked at Riley again. How long do you need? He asked. Her heart thudded once hard enough that she felt it in her fingertips. This was the question she had not wanted to hear. Minutes, she said. Not an hour, not half, 5 at most, probably less. Marcus shook his head. You cannot seriously be considering handing her a scalpel in here. I am not asking you to be comfortable, Logan said. I am asking you to let the person who has actually walked this road lead for 5 minutes. I am the surgeon of record, Marcus said. My license, my liability, my signature. If I let a nurse perform an unapproved decompression and something goes wrong, I do not just lose a limb, I lose this hospital. Riley swallowed. Then do it yourself, she said. Use the technique. I will talk you through where I think the pressure is. You keep control. Marcus stared at her. You think I am going to try a blind release based on your fingers and a story from Iraq? That is not what I said, she replied. I said the pattern is familiar. The plane is here. She pressed gently along the forearm again. You can feel the bulge. You can feel where the fascia is trapping. It is not magic. It is anatomy under stress. I know anatomy, he snapped. Then you can feel it, she said. The room held its breath. Marcus stepped closer almost in spite of himself. He placed his hands where hers had been, fingers tracing along the taut skin. He pressed down following the same path she had traced. His brow furrowed. Under his fingertips, the forearm told the same story. Compressed muscle-trapped vessel, that peculiar density of tissue that had not yet gone slack with decay. He pulled his hands back. Even if I accept that there is a choke point, he said, there is still no guarantee that a release brings back flow. We could open this and find nothing but dead fiber. We will not know until we open it, Riley said. He looked at Logan. If I do this, I want it on record that I advised against it. You already said that, Logan replied. Twice. Probably going on 3 times. It matters, Marcus said. Then write it down, Logan said. But hear me. This is my arm, my career, my future. If there is a sliver of a chance and you refuse to take it, that is something you live with, not me. I will be too busy learning how to tie my boots with one hand. The line landed with more weight than the half-joke in it suggested. Jen glanced at the clock. Doctor, she said quietly, we are inside that 5-minute window now. Marcus closed his eyes for half a second, then opened them. Heart, he said. She straightened. If I say yes, he said, and you touch that arm with anything sharper than your fingers, you are following my orders to the letter. You are not freelancing. You are not reliving your greatest hits. You do exactly precisely what we agree on and nothing more. Riley nodded. Understood. And I reserve the right to stop you the moment I think we have crossed a line, he added. Understood, she said again. He sighed. It was not surrender. It was calculation wearing the mask of resignation. Jen, he said, page anesthesia and tell them the case may delay. And call Navarro when she comes up for air. I want her aware of this. Jen nodded and stepped out with her phone already in her hand. Marcus turned back to the table where the instruments lay in their sterile packaging. The small silver glint of a scalpel handle sat near the top. He did not reach for it. Riley did in her mind. Her fingers remembered its weight. The way it sat just right between thumb and forefinger, an extension of bone. She flexed her hands once as if shaking off something sticky. Gloves, she said quietly. A resident blinked, then moved to the cabinet and pulled out a fresh pair, handing them over without thinking. That was how deep the habit ran. Someone gave an order, someone else responded. Riley slipped her hands into the new gloves. The snap of latex at her wrists sounded loud. Captain Price, Marcus said, his voice taking on the clipped rhythm of consent again. For the record, do you understand that we are about to attempt a pressure release that is not standard procedure in this facility, and that the risks include but are not limited to additional bleeding, infection, nerve damage, and the possibility that your arm is still lost in the end? I understand, Logan said. And you still wish us to proceed, Marcus said. I do, Logan said. Polite said. Riley reached for the sterile drape. Her movements had the same economy they always had, but there was a new tension in the air around them. She unfolded the blue square and laid it over Logan's chest, exposing only the bulging length of his forearm and hand. The light overhead caught on the slight sheen of sweat on his temple. His gaze found hers. "Do your thing, Nightingale," he said softly. Her breath hitched. She looked down, focused on the field. Her fingertips settled one last time along the tightest band of tissue marking the invisible line in her head. "Scalpel," she said. A resident placed the scalpel handle in her palm. The metal was cool through the glove. Riley wrapped her fingers around it. For a heartbeat, she did not move. The room held steady around her. Monitor beeps, the faint whir of the air vent, the rustle of a gown as someone shifted weight. She angled the blade toward the swollen forearm. "Incision here," Marcus said, pointing 2 centimeters off from where her fingertips had marked. Riley shook her head once. "Higher," she said. "You will just skim fluid there. The pressure plane is tighter along this line." She tapped the skin lightly with one gloved finger midway between wrist and elbow, just off the bone. Marcus looked like he wanted to argue, then stopped, his lips pressed together. "Fine," he said. "Short, controlled cut, no deeper than fascia until we can see where we are." Riley nodded. She set the tip of the blade on the skin. For one split second, the overhead lights washed into desert sun. The hospital walls dissolved into the canvas of a tent. The smell of antiseptic sharpened into dust and diesel. Her hand did not shake. The first stroke opened the skin in a clean line. Blood welled along the slit bright and quick, then slowed as it met the pressure beneath. A resident sucked in a breath. "Measure," Marcus said sharply. Another resident read the monitor. "Vitals stable." Riley deepened the cut with delicate pressure, feeling the give of tissue layers. She knew each one without seeing it, the way a musician knows a song by ear. Subcutaneous fat, the thin resistance of fascia. She paused there. The swelling pushed against the blade from inside, eager and trapped. "In the field," she said quietly. More to remind herself than them. "We follow the compartment, not the textbook lines. If you cut in the wrong direction, you miss the choke and just bleed on top of the problem." "This is not the field," Marcus said. She ignored the comment. She shifted the angle and eased the blade through the fascia. The membrane split with a faint, wet sound. For a moment, nothing happened. Then the muscle bulged upward. The skin relaxed a fraction around it as trapped pressure spilled into the new gap. Dark, thick blood seeped from deeper inside, heavy with the waste of starved tissue. "Sponges," she said. A resident snapped to pressing a gauze pad gently beside the opening, careful not to crush the very flow they were trying to encourage. The monitor counted beats. 82. Blood pressure 94/60, someone called. Riley traded the scalpel for blunt scissors, her hands already moving. She slid the rounded tip along the line of the cut and spread the fascia further, following the length of the muscle belly. More of the packed tissue rose, then settled. The upper part of the limb seemed to sigh as the internal clamp loosened. She could feel it almost as a change in the air, a release. Her gaze flicked to the hand. The fingers were still swollen and discolored. No miracle yet. "Check radial," she said. The resident with the Doppler jumped as if he had forgotten he was holding it. He pressed the probe back over the inner wrist just above the thumb side. "Static." He adjusted, pressed again. "Static." "Nothing," he said. His voice was thin. Marcus leaned in. "Give it a minute," he said through his teeth. Riley sank the scissors another centimeter along the fascia, opening the sheath deeper, making sure the muscle had room to expand without crushing its own vessels. The smell changed a mix of iron and something sour that belonged to tissue that had been strangled but not yet rotted. It wrapped around the bright hospital scents and sat there. Jen fought the urge to wrinkle her nose. "Come on," Riley whispered so soft it was almost not sound. Her thumb brushed gently along the exposed muscle. It was firmer than healthy tissue, but there was a suggestion of warmth there, of potential. She lifted her head. "Check again," she said. The resident placed the Doppler. This time he held his breath. The room seemed to lean with him. A faint whoosh crackled through the small speaker. It stuttered uneven at first, but distinct, arterial. "I have something," he said, voice rising. Voice rising. "Again," Marcus snapped. The resident repositioned, pressed, listened. The sound came through stronger this time. A small river forced open. "Radial pulse present diminished, but present," he said. The words seemed to widen the room. Riley exhaled. She had not realized how tightly she had been holding her breath. "Cap refill on the fingers," she said. Another resident pressed on the nail bed of Logan's index finger. It blanched, then slowly flushed color seeping back in a delayed but visible wave. 3 seconds, he said. "Maybe a bit more." "Better than infinite," Marcus muttered. Logan let out a shaky laugh that turned into a hiss. The new pressure movement hurt, but it was a different kind of hurt. not distant and dull, but sharp and localized. I can feel something, he said. Describe it, Marcus said. Pins, Logan answered. Not exactly, but close, like when your leg falls asleep and starts to wake back up, just lighter. It is going to get worse before it gets better, Marcus said. Nerves do not enjoy coming back online. Alive is better than numb, Logan said. Riley wiped around the incision with a gauze pad, clearing the worst of the pooled blood. She could see the muscle contracting subtly with each heartbeat now, like it had been waiting for permission. She turned to Marcus. We should extend the release a bit proximally, she said. The compartment is larger than that one plane. I know where the compartments are, he said, but there was less bite in it. He took the scissors from her. His hands, practiced and precise, followed the path she had started carrying the cut, a few more centimeters up and down the arm. He deepened it slightly, exposing more of the engorged tissue to the air. Watch his pressure, he called. Still stable, someone answered. Riley stood back a step, the scalpel handle now lying harmless in the metal tray. Her pulse had not slowed yet. It thudded in her ears, mixing with the monitor. For a moment, she saw another arm under her hands, different skin, different uniform. A desert tan sleeve soaked dark. A man gasping through gritted teeth while mortar thumps shook the ground. She blinked and the memory slid away. Jen placed a fresh dressing pack within reach. Once you are satisfied with the decompression we need to pack and cover, she said. I am not sealing this up tight yet, Marcus replied. We are not out of danger. No one said we were, Jen said. He looked at Logan. This buys you a chance, he said. Not a guarantee. You still might lose the arm if tissue down the line has already died. If things go south, we will be back to the original plan. Logan nodded, sweat beading along his hairline. I can work with a chance, he said. Riley watched his face. The tension etched there had shifted. It was not relief, not exactly. It was the subtle release of someone who had braced for impact and felt the blow land less hard than expected. She peeled off her outer gloves, dropping them into the open waste bin. Her hands beneath felt clammy. Do you need me here, doctor? She asked Marcus. He glanced over his shoulder. Not at the moment, he said. You did what you came in to do. The words could have cut, but something in his tone kept them neutral. Thank you, Hart, he added after half a beat. It surprised her enough that she almost did not recognize her name. You are welcome, she said, and meant it in the simplest way. She stepped to the side out of Marcus's immediate circle, but did not leave the room just yet. She stayed long enough to see him pack the incision with loose gauze to keep the decompressed muscle from bulging too far, then lay a temporary dressing over it. The swelling already looked slightly less severe along the edges. Check distal motor function again, he said. The resident bent over Logan's hand. Sir, can you try moving your fingers once more? Logan focused his gaze on his hand like he was lifting something heavy with his eyes. This time his index finger curled a visible few millimeters, followed by the middle finger. They did not move far, but they moved. A low sound broke from a nurse near the door, part laugh, part exhale. There you go, Logan said through clenched teeth. That is more like it. Riley could not help it. A small smile tugged at the corner of her mouth. It felt unfamiliar there. She caught Logan looking at her. The smile faded into something softer. That thing you just did, he said. You did it back then too. On Sergeant Neely's leg. I remember the way you kept your voice flat while you were elbow deep in blood. I keep my voice flat when I am concentrating, she said. It keeps my hands from thinking for themselves. Marcus tied off a last piece of gauze and stripped off his gloves. His shoulders dropped a fraction. All right, he said. We will hold on the amputation for now. Move him to a monitored bed. Vascular consult, repeat lab serial exams on that limb every hour. First sign of deterioration, we reevaluate. One of the residents nodded and began entering orders into the computer. Jen adjusted the IV lines and checked the new dressing. We will keep him close to the nurse's station, she said. No one is losing track of this one. The paramedic gurney was gone now, replaced by the more solid hospital bed. The chaos of the initial arrival had condensed into narrower focus. Riley stepped back until she felt the wall touch her shoulders. Her legs ached, though she had not moved much. Adrenaline draining her mind supplied. Riley, Jen said quietly. She turned. You can step out, Jen said. Grab some water, breathe for a minute. Riley nodded. Yes, ma'am. She started toward the curtain. Hey. Logan's voice stopped her. She turned her head. He was watching her through half-lidded eyes, the edges of his vision fuzzed by pain and medication, but his focus was clear. You saved my arm, he said. Again. She opened her mouth to correct him, to say there were more steps, more people, more maybes, but the words did not come. Instead, she said, "Your arm has a chance. Hold on to that." "I will," he said. "But for the record, Nightingale always brings her people home." The name settled between them. Riley felt everyone in the room hear it. "I am not her anymore," she said quietly. He smiled a small crooked line. "Could have fooled me." She pushed through the curtain before anyone could ask what that meant, leaving the white bright square of Bay 3 behind her. Riley found the nearest empty alcove and stepped into it before her legs decided she did not get a vote. It was barely more than a recessed space between two supply closets. A plastic chair leaned against the wall, a poster about hand hygiene peeled at one corner. From here, she could still hear the emergency department in full rhythm, but it felt a shade further away, the noise muffled by drywall and the thin curtain she had just walked through. She braced her hands on the back of the chair and dropped her head. Her pulse thudded in her ears. The smell of blood clung faintly to her skin beneath the soap and sanitizer. When she closed her eyes, she could see the line she had cut in Logan's arm, the way the muscle had bulged against the new space, the hesitant beat of returning flow. She also saw other arms, other legs, sand packed into wounds, a helicopter interior shaking with every second of flight. She inhaled until her lungs ached, then let the air out, slowly counting numbers in her head. 1 to 4 in, 1 to 6 out. She had learned that trick long after the war, in a small room with soft lamps and a therapist who kept her voice gentle, even when she said difficult things. It worked better than pretending nothing had ever happened. "That was not standard," a voice said. Riley lifted her head. Dr. Elena Navarro stood at the edge of the alcove, a tablet in one hand, dark hair pulled back in a bun that had started to come loose. There were faint circles under her eyes, proof she had been running her own crash course in another wing before appearing here. Riley straightened. "Doctor," she said. Navarro stepped closer, staying just far enough away that Riley did not feel cornered. "I just read the note Marcus put in the chart," she said. "Then I talked to 3 different people who all gave me the same look when I asked what happened." "What look?" Riley asked. "Anonymity. The look people give when they have seen something they do not have a name for yet," Navarro said. Riley gripped the back of the chair a little tighter. "We relieved pressure and restored radial flow," she said. "He still may need more surgery, vascular grafts, nerve work. It is not a miracle." "I am aware," Navarro said. "I am also aware that it was you who marked the incision line, and you who took the first cut." "Under Dr. Shu's orders," Riley said. Navarro's mouth tilted. "That is what he wrote," she said. "I did not get the impression that was how it started." Riley looked at the scuffed floor tile. "He gave consent. He remained the attending. I did not act without permission." "That is not what concerns me," Navarro said. "What concerns me is how comfortable you seemed holding that scalpel." Riley did not answer. Navarro watched her for a moment, as if measuring something that did not show on a vitals chart. "You list 3 years as an Army medic in your employee file," she said. "No details, just dates and branch." "That is what happened?" Riley said. 3 years covers a lot of ground," Navarro said. "Some medics leave the service having done mostly vaccinations and sick call. Others leave having done things that civilian medicine has barely written papers about." Riley felt the chain under her scrub top press against her sternum as she inhaled. "I was deployed," she said. "Twice." Navarro nodded. "Marcus is angry," she said. "Mostly at himself for letting you take the lead. Partly at you for being better at that particular thing than he was. He will get over it." "I was not trying to show him up," Riley said. "I know," Navarro replied. "He does too under the ego." She shifted the tablet to her other hand. "I am not going to ask you for your war stories," she said. "This is not the time and it is not my place. But I will tell you this. There are skills you have that I am interested in understanding, for the sake of the next price who rolls through those doors." Riley looked up surprised. "You are not upset," she said. "Oh, I am very upset," Navarro said. "That we almost chopped off an arm we did not have to. At the system that taught you something useful and then made you feel like you have to hide it to fit into a new life." Her tone stayed even, but there was heat under it. "We will talk," she added. "After tonight. For now, drink some water. Find your center before I send you back into the pit." Riley hesitated. "Is he stable?" she asked. "Price," Navarro said. "Yes, for now. We have him in a step-down bay near the nurse's station. He is awake, some pain, some relief, a lot of stubborn." Riley could picture that. "Thank you," she said. Navarro studied her for another second. "Get some air, Hart," she said. "Then clock back in. Night is not over yet." She moved away, blending back into the stream of staff heading toward the main hub. Riley pushed off the chair. Her legs felt steadier. She walked to the nearest sink, scrubbed her hands again, and watched the thin stream of pinkish water swirl down the drain until it ran clear. The dog tag under her shirt shifted when she straightened. She ignored it and went back to work. Time slid by in a series of smaller tasks. She checked blood sugars in a quiet row of rooms, adjusted an oxygen cannula on an older woman who apologized for needing help, drew labs from a teenager who pretended not to be afraid of needles. The ordinary work grounded her. It always had. One patient at a time, one small action at a time. Near midnight, the noise in the emergency department thinned. The initial wave from the freeway pileup had either moved upstairs or gone home. The whiteboard behind the nurse's station had fewer names on it. "Hart," Jen called. "You are due for a break. Take 10. "I am fine," Riley said. "I am not asking," Jen replied. "Go." Riley did not argue. She poured herself a paper cup of water and headed down the side corridor that led toward the recovery bays and a bank of floor-to-ceiling windows. Outside, the storm had calmed. Snow still fell, but in slow, lazy flakes, now drifting in the glow of the parking lot lights. The city beyond was a blur of muted yellows and reds behind the fogged glass. At the far end of the corridor, a door stood half open, Recovery Bay 4. A soft chime sounded from inside. Not the sharp alarm of trouble, just a reminder to check a drip or a monitor. Riley stopped a few steps away. She had not come here on purpose, but she was not entirely surprised to find herself in front of this room instead of the staff lounge. She told herself she was only checking the monitor through the doorway, making sure the waveform was still steady. She looked. Logan sat propped up slightly pillows behind his back. His injured arm was no longer bound across his chest. It rested in a bulky temporary splint and sling forearm, elevated on a stack of folded towels. A fresh dressing covered the decompression site, white gauze edged with a faint bloom of pink. His eyes were closed, but his jaw worked slightly like he was grinding down a thought. A heart monitor at his side traced a steady line of green peaks. The sound was softer than in the trauma bay, turned down to a gentler volume for post-op rest. Riley stood in the doorway and took a slow sip of water. "You going to come in?" he asked without opening his eyes. "Or just lurk there and judge my posture?" She almost dropped the cup. "I am not judging anything," she said. His eyes opened. They were less washed out under the dimmer light here, more human. "Then it is the other one," he said. He said, "making sure I am still alive." "That is sort of the job," she said. He glanced at his monitor. "Looks like I am passing." "For the moment," she said. He gave a small smile. "Come in," he said. She hesitated, then stepped into the room and let the door swing a little closer behind her. It did not click shut, but the gap narrowed. Up close, he looked more tired. The adrenaline had burned off, leaving lines at the corners of his eyes that spoke more of accumulated nights than of this single one. "How does the arm feel?" she asked. "Like you let a truck park on it, then changed your mind and drove the truck off," he said. "But I can feel the hand. That is new." He flexed his fingers carefully. The movement made his jaw clench, but the fact that he could move them at all was remark enough. Riley nodded once. "That is a good sign," she said. "Good sign," he repeated. "I like those." She stayed near the foot of the bed, hands in the pockets of her scrub top, the paper cup turning in slow circles between her fingers. "You did not have to come check on me yourself," he said. "You could have sent any nurse in here, or let them handle it." "I am on break," she said. "I was walking past." "Sure," he said. His tone said he did not buy it, but he was not planning to push that point. They let a few seconds pass with only the soft beep of the monitor filling the space. "You gave everybody a scare back there," he said. "You signed a consent for amputation," she replied. "That was not exactly low drama." "I have had worse news," he said. "We have all had worse news." His gaze slid to her chest, to the place where the chain under her scrub top pressed faintly against the fabric. "You still wear it," he said. Her fingers moved before she could stop them curling around the tag, through the cotton. She let go as if burned. "I do not know what you are talking about," she said. "The tag," he said. "Ortiz, Miguel Ortiz. He used to joke that if he ever died, that hunk of metal would haunt whoever wore it." Her breath stalled. "How do you know that name?" she asked. He watched her face. There was no triumph in his expression, only something heavier. "Because he was my radio operator," he said. "Because I was there." Her knuckles tightened around the paper cup until it crumpled. A small arc of water splashed over her fingers. She did not seem to notice. "They told me you did not remember that part," she said. The words came out flat. "They told you a lot of things," he said. None of them asked me. She swallowed. The room felt smaller, the walls inching closer. I remember him falling, she said. I remember him hitting the ground. I remember grabbing for him and losing my grip because everything was slippery and loud. She stared at a point just past his shoulder, at the curtain that separated his bed from the rest of the world. I remember freezing for a second, she went on, just long enough to make it my fault. He shifted, careful not to jostle his arm. You carried 2 of us out after that, he said, bleeding yourself. That is not what freezing looks like. Does not change that he stayed there, she said. Silence stretched between them, dense and full. The monitor kept time. Why are you here, Captain? She asked finally. At Mercy Ridge, in my bay, on my shift. He held her gaze. Maybe because there was something you needed to hear from somebody who actually saw it, he said. She did not ask what, not yet. Her break timer buzzed on her watch, a small vibration against her wrist. She silenced it with a tap. You should rest, she said. So should you, he replied. She turned toward the door. Riley, he said quietly. She stopped. You did not fail him, he said. Her shoulders stiffened. She did not look back. You do not know that, she said. I do, he answered. The words sat between them unclaimed. She opened the door the rest of the way and stepped into the hallway, leaving the soft beep of his monitor behind her. The hallway was cooler than the recovery bay. Riley felt the shift on her skin as soon as the door closed behind her. She walked toward the windows without really deciding to. The soles of her shoes made soft squeaks on the tile. Somewhere nearby, a bed alarm chimed and then cut off. Farther away, someone laughed in a way that sounded more tired than amused. At the end of the corridor, the glass ran from floor to ceiling. Snow blurred Denver into a wash of gray and yellow shapes. Her reflection hovered faintly in the pain scrub top, badge hair pulled back tight. If she looked past it, she could almost see the outline of another landscape entirely. She leaned one palm against the glass. It was cold enough that her skin prickled. You always move that fast when someone says you did not fail. Logan's voice came from a few steps behind her. Riley closed her eyes briefly, then opened them again and looked at his reflection, rather than turning. He had walked out with more care this time. Hospital gown slings secured properly bare feet in hospital socks that made him look less like the man from the trauma bay and more like any other patient. His good hand rested lightly on the doorframe of Recovery 4, just in case his balance shifted. You are not supposed to be wandering the corridor, she said. You just had an invasive procedure, twice. Not wandering, he said. Targeted movement. You should be in bed, she said. That is a lot of should for one sentence, he replied. He let go of the frame and took the last few steps to stand beside her, leaving a polite space between them. His reflection joined hers in the glass, the sling a pale slash across his chest, the bruising around his eyes a shadow. They stood there in silence for a moment, watching the snow. You know what I remember most from that day, he said finally. Which one, she said. There were a lot of days. The alley, he said. The blast. Ortiz, you, take your pick. Her hand curled against the glass. I remember too much of it already, she said. You remember one version, he said. I remember another. She turned her head, then enough to actually look at him. You do not know what I see when I close my eyes, she said. No, he said, but I can guess. He inclined his head slightly, inviting without pushing. She could have walked away. She did not. Riley looked back out at the snow. It was supposed to be routine, she said. A patrol, nothing flashy, just a loop through the neighborhood and back to the outpost. We had done it a dozen times before. The glass fogged a little with each breath as she spoke. The radio kept cutting, she went on. Ortiz kept smacking it with his hand and swearing he would trade it for a rock and 2 tin cans if it did not behave. For the first time since he had left his room, Logan smiled. It was quick and then gone. They liked you, he said. They liked any medic who carried extra tourniquets and candy, she said. I was not special. You were the only one who made Ortiz shut up when he started singing, he said. She did not deny it. She could see it in her mind. The inside of the Humvee, the cramped benches, the radio crackling in Ortiz's lap. Logan in the forward seat helmet tipped back a fraction, eyes scanning the narrow street through the small armored glass. We hit the intersection, she said. The one with the half-broken wall and the blue door. I remember thinking the light looked wrong. Too still, Logan said quietly. She nodded. Too still. No kids, no bread sellers, just heat pushing down. She swallowed. And then the world went sideways, she said. The first blast had not been loud in her memory. It was the way the air had changed that stuck with her. 1 second it was heavy with dust and exhaust. The next it was gone, punched clean out of her chest. The Humvee listed, she said. Metal screamed. I remember grabbing for the ceiling handle and missing. I remember Ortiz shouting something I could not hear because my ears were full of static. She could feel it in her bones now, the lurch of weight, the sudden rain of debris. The window blew out, she said. Glass or plastic or whatever that stuff has hit my face. I was already half on top of Ortiz when the second hit came. She stopped, jaw clenched. Logan did not fill the silence. I remember tasting sand, she said eventually. It got in my mouth and my nose and the cut on my lip. Everything went brown and white and red all at the same time. Her hand slid down the glass, leaving a faint streak. I could not hear anything, she said. Just a high noise like the monitor when it flatlines, but inside my head. Her throat tightened, as if the dust was there again. I saw Ortiz move, she said. He was saying something to me. I know he was. His mouth was moving. I just could not get the words. She finally looked back at Logan. He was still alive, she said. I know that much, and I froze. He met her gaze steadily. How long did you freeze? He asked. Long enough, she said. Long enough for it to be my fault. That is not a number, he said. It felt like forever, she said. Feelings are not clocks, he replied. She let out a breath that was almost a laugh, but not. You were not there inside my head, she said. I was there inside that vehicle, he said, and I was the one with a hole in his chest. You think I was not counting every second? His tone was gentle, but the words were sharp. She looked away again. I remember looking down and seeing my own leg bleeding, she said. I remember thinking that is inconvenient, and then hating myself for having a stupid thought when Ortiz was lying there. Her fingers found the chain under her scrub top, pressing the tag into her skin. I did not move, she said. Not at first. I just stared. It was like my body forgot how. What broke it? He asked. She could still see the exact thing. A kid ran out from behind the blue door, she said. He could not have been more than 10. He had a phone out. He was pointing it at us like a camera. Her lips thinned. Someone had told them that if they filmed the aftermath, they would get money, she said. Or maybe they were just curious. Either way, he aimed it at Ortiz and then at me. And I thought they are going to make a movie of him dying and me sitting here doing nothing. Her voice went flat on the last word. So, I moved, she said. I do not even remember the first action. I just remember suddenly being halfway out of the vehicle dragging a tourniquet over his leg. I remember shouting at him to shut up even though he was not talking. Logan nodded slowly. I remember some of that, he said. Not that kid, but your voice. You remember me yelling, she asked. I remember you making decisions, he said. Sounded like yelling because everything else was so loud. She let out a breath. I did not feel decisive, she said. I did, he said. Her shoulders sagged a fraction. I got a tourniquet on him, she said. I think. It is fuzzy. There was so much blood. He kept trying to sit up. I kept pushing him down. The radio was spitting static, and some sergeant somewhere was screaming for a sit rep. Her knuckles were white on the chain. And then you were there, she said. Or I was there with you. It blurs, chest wound, air bubble. I remember thinking that if I messed up the seal, I would watch you drown from the inside. You did not, he said. I got lucky, she said. He shook his head. You went through the steps, he said. You cleared the airway. You sealed the hole. You kept my lung from collapsing any more than it already had. You sat on that street with your hand on my chest while rounds popped off down the block, and you talked me through every breath. He said it matter of fact, like he was reading from a report, but his eyes were bright. I remember you counting, he said. In, out. You sounded annoyed, not scared. It made me think maybe I did not need to be scared either. I was terrified, she said. You did not show it, he replied. She tilted her head back against the glass, closed her eyes again. Every time I think about that day, she said, it starts with Ortiz hitting the ground and ends with Ortiz hitting the ground. I know there was more. I know I moved, like you said, but all my brain plays is that one frame, him falling, me not fast enough. She opened her eyes but did not look at him. They medevaced you out, she said. They told me you were in critical condition, then stable, then gone up the chain somewhere I would never see. They gave me a pat on the shoulder and a bigger caseload. Ortiz got a folded flag and I got to stare at his empty bunk. The glass in front of her stayed cold. Her breath made small clouds on it. In the debrief, she said, someone said the words appropriate response under the circumstances. I wanted to hit him. Appropriate does not bring anyone back. Logan was quiet for a long moment. There is something messed up about the way they write those reports, he said. They turn people into bullet points. Ortiz was a bullet point, she said. He should have been an entire book. He talked about that, Logan said, being a footnote. He joked that when he died they would spell his name wrong. They did, she said. He huffed out a breath that might have been a laugh if it had any humor left in it. Of course they did, he said. Her hand dropped from the chain at her neck. It felt heavier now, as if someone had attached fresh weight to it. I went home with his tag, she said. His mother said she wanted me to have it. She said he would have liked that. I did not know what to say, so I just nodded. I have been wearing the proof that I let him die around my neck ever since. She glanced at him, daring him to argue. He did not yet. You think that, he said, and still you walked into a civilian hospital and put on scrubs. She shrugged. I thought maybe if I changed uniforms it would change what was in my head. Did it? He asked. Some days, she said. Most days I keep busy enough that I do not hear the flat line. Then something hits wrong, a sound or a smell, and I'm back there watching him fall. She pressed her lips together. When you rolled in tonight, she said, for a second I thought someone was playing a cruel joke. Same uniform, same look in your eyes, same choice in front of me. Do something or watch it happen. And you did something, he said. It does not rewrite what came before, she said. No, he agreed. It does not, but it says something about who you are when it happens again. She did not answer. The corridor lights buzzed quietly overhead. Snow tapped against the glass in soft, irregular sounds. If you came here to make me feel better, she said, it is not working. I did not come to make you feel better, he said. I came to say what everyone else has tiptoed around. She turned to him fully now, arms crossed. And what is that? She asked. That you are not as powerful as you think you are, he said. The words landed wrong on purpose, sharp enough to get under her guard. If I was less powerful, he would have lived, she said. If you were actually in control of who lives and dies, he said. Then, yeah, maybe, but you are not. None of us were. We like to pretend we are, but at the end of the day, we are just people standing in the blast radius, making choices with half the information. She looked like she wanted to argue, then shut her mouth on whatever she was going to say. You did not fail him, he said again, softer this time. She shook her head, tiny stubborn. You keep saying that, she said, and I keep seeing him bleed out. His gaze drifted past her shoulder to some point only he could see. Then maybe the problem is not what you saw, he said, but what you did not. Before she could ask what he meant, a voice crackled over the overhead speaker, calling a nurse to a different bay. The spell of the moment thinned, but did not break entirely. Riley pushed away from the glass. I need to get back, she said. Break is over. Riley, he said. She did not stop this time. You did not fail him, he said one more time. She walked away without answering the tag under her scrub top, tapping once against her skin with each step. The rest of the shift came in small, jagged pieces. Riley moved through triage questions and medication checks on automatic. A man with a twisted ankle argued about his wait time. A woman in a red coat cried quietly over a blood pressure reading that scared her more than it should have. An older patient kept calling her by his granddaughter's name and apologizing when he caught himself. She answered, reassured, adjusted, charted. Her hands never forgot what they were supposed to do. Her mind drifted anyway. You did not fail him. The words followed her from room to room, like a shadow half a step behind. At the nurse's station, Jen slid a cup of coffee across the counter. It left a faint ring on the laminate. You look like you are thinking too much, Jen said. I am working, Riley replied. That is not what I said, Jen answered. Riley wrapped both hands around the cup, letting the heat sink into her fingers. The smell of burnt coffee cut through the antiseptic in the air. I am fine, she said. Jen watched her a moment longer, then let it go. Price needs his next set of vitals in 30, she said. You want him or you want me to send Kyle? I will take it, Riley said too quickly. Jen's mouth twitched. Then take a breath first, she said, and drink that. Riley did, swallowing past the tightness in her throat. When the 30 minutes were up, she walked back down the hallway to Recovery 4. The snow outside had thickened again, pressing a quiet white curtain against the windows. Light spilled from the half-open door of his bay. This time she knocked on the frame once before stepping in. Logan looked up from the small television screen on the wall, where muted images of a late-night talk show flickered without sound. The remote sat in his good hand untouched. Back to make sure I still have a pulse, he said. Every 4 hours, she said. Hospital rules. We both know you are better at reading pulses than that, he said. She set her equipment on the side table and wrapped the cuff around his right arm. His skin was warmer now, some color back in his face. Hold still, she said. I am currently nailed to the bed by tubing and pain, he said. I am not going anywhere. She pressed the temperature probe against his ear, clipped the pulse ox to his finger, watched the numbers populate on the monitor. Heart rate steady, oxygen good, blood pressure low but acceptable. "Looks decent," she said, for someone who insisted on arguing in the hallway. "You ran away from the argument," he corrected. She busied herself with the chart on the computer. "It was not an argument," she said. "It was you talking, and me deciding I had to be somewhere else." "You did not have to be," he said. She did not answer. He shifted slightly on the pillows, his face tightening, as his arm reminded him it was still there. "They teach you in medic school how to disappear that fast?" he asked. "Or did you come by that naturally?" She rolled her eyes at the screen. "You are supposed to rest," she said. "I rest better when people stop taking the blame for things that are not theirs," he said. She looked at him. The room was dimmer here than in the trauma bay, softer. It made his bruises look darker, his eyes clearer. "You are very sure about something you could be wrong about," she said. "I am very sure about something I watched," he said. She crossed her arms, then uncrossed them, fingers curling instead around the back of the chair by the bed. "You said earlier that the problem might be what I did not see," she said. "Say whatever you think that is, and then we are done." "That depends on whether you listen," he said. "Talk," she said. He let out a slow breath. "I was in the lead truck," he said. "You were in the second. Ortiz was behind you. I could see you when I turned, not clearly, but enough to know where you were sitting." She pictured it unasked. Humvee 1, Humvee 2, dust between. "That intersection was wrong," he said. "You were right about that. The light, the quiet." His gaze went distant past the ceiling. "I saw a kid on a roof," he said. "Not the one with the phone. Smaller. He had a wire in his hand. I started to call it in, but by the time I got the words out, the world was already folding in on itself." Riley's fingers tightened on the chair. "The first blast hit the lead vehicle hard," he said. "We took it across the front end. I remember the windshield going white, then black, then nothing. I must have been out for a second because when I opened my eyes, my chest felt like someone had parked a truck on it, and there was smoke everywhere." He spoke slowly, as if laying each piece down where she could see it. "I heard Ortiz on the radio," he said. "He was yelling medic and a string of words I am pretty sure they did not teach him in any polite Spanish class. He said you were up, that you were moving, that you were already at my door." Her throat constricted. She had not known that part. "I looked over," he said, "saw the back door of your truck open, saw you half out the side reaching for your aid bag. You were leaning toward us." He paused. The monitor ticked on. "And I saw Ortiz," he said. "He was between you and the street. He saw something I did not. I do not know if it was a glint of metal or the way a shadow moved, but he shoved you down so hard you hit the floor. I saw your helmet bounce." Riley's chest tightened. She did not remember that. "You were already reaching for him when the second blast went off," Logan said. "He took it. You did not. The angle was just enough that the shrapnel found him and missed your head by inches." The room felt smaller, the air heavier. She gripped the chair so hard her nails bit into the plastic. "No," she said. "Yes," he replied. "You think you sat there and watched him go down while you did nothing? What actually happened is he made a choice in a fraction of a second and put himself where you were supposed to be. He did not do it because you froze. He did it because that is who he was." She shook her head, a small disbelieving motion. "I remember him on the ground," she said. "I remember thinking I should have pulled him back first, that if I had moved sooner, he would not have been there." "You could not have dragged him out of something you did not see coming," Logan said. "You were already moving toward me, toward the blast. That is why he pushed you away." She swallowed hard, her vision blurred at the edges. "Why did no one tell me that?" she asked. The question came out hoarse. Logan looked at her, the lines around his eyes deepening. "They told you what made clean sense on paper," he said. IED, KIA, medic present. They wrapped it in official language and handed you enough of it to keep you going, not enough to make you ask questions they did not want to answer. "Who is they?" she asked. Paisetta asked. "Take your pick," he said. "Command. The officer who wrote the report. The chaplain who thought he was protecting you by not describing how close you came to being under that flag instead." Her jaw clenched. "I spent 7 years thinking he died because I hesitated," she said. "You hesitated for a second because your brain got scrambled by an explosion," Logan said. "Then you moved. He died because he stepped in front of you after you moved. Those are not the same thing." Her eyes burned. She blinked, but the tears pooled anyway, hot and unwelcome. "He should not have had to," she said. "I agree," Logan said, "but the fact that he did is not an indictment of you. It is a mark of the kind of man he was." The dog tag under her scrub top felt suddenly very real against her skin. Heavy, solid. So he died saving me, she said. The words tasted wrong in her mouth, like something she had never allowed herself to say. Logan held her goal. Ing held her gaze. Yes, he said. Whatever she had been holding in her chest cracked then. Not in a dramatic way, not with sobs, but with a sharp, shuddering breath she could not quite control. A single tear slid from the corner of her eye and fell onto the back of her hand. I do not know what to do with that, she said. I do not know how to carry that. You have been carrying it, he said. The wrong version, but still. You have been punishing yourself for his choice instead of honoring it. She laughed once, a broken sound. Honoring it, she said. I took a job pretending I was just some nurse who had never seen blood outside a textbook. You took a job where you could keep the people from getting folded into body bags, he said. You stayed in the fight, even on nights when you think you did not. She sank into the chair without meaning to. Her legs felt hollow. He used to say he would take whatever hit came first, she said quietly. He always stepped to the front in photos, the guy who wanted to be in frame. Ortiz loved a camera, Logan said. He would be delighted to know he actually blocked a shot. She sniffed in spite of herself. You think he would be okay with this? She asked, fingers ghosting over the tag again. With me still here, with this. If he was not, Logan said, he would be haunting your coffee instead of your dreams. She let out a small breath that was almost a laugh this time, with a trace of warmth in it. Silence settled again, but it felt different now. Less like a weight, more like a space where something new might eventually fit. The monitor beside the bed kept its steady rhythm. Beep, beep. The sound that had once been married in her mind to the flat whine of a failing heart began very slightly to separate from it. I still see him fall, she said. You will, Logan said. For a while, maybe always. But now, maybe you also see what he did before he hit the ground. She nodded, eyes fixed on the blanket over his knees. The corridor outside the room was quiet. Night had settled thick over the hospital. Somewhere a cart rattled softly over tile. Somewhere a nurse lowered a light so a patient could sleep. A chime sounded overhead. Code Blue, Recovery Bay 4. The words dropped into the room like a stone into water. For a heartbeat, Riley did not move. Her brain tried to match the room number to the space she was in. Logan's eyes widened. That is my bay, he said. Riley was already on her feet, the chair skidding back with a squeal. Her own pulse leaped the sound of the overhead call crashing into the past and present all at once. She stepped into the hallway at a run. Riley sprinted down the corridor. Her shoes hammered the tile, each strike a sharp slap that carried too far in the quiet of the night shift. The overhead lights blurred into a white ribbon above her. The hallway narrowed and stretched at the same time. Code Blue, Recovery Bay 4, the speaker repeated. Staff parted for her without thinking. A transport tech pushing an empty wheelchair flattened himself against the wall. A respiratory therapist with a cart jerked to a halt. A nurse coming the other way stopped, dead eyes tracking Riley as she ran. Her lungs burned, but the air felt thin like the tent air in Iraq. Her body stored that memory in her muscles, not her mind. It came back now. Recovery 4's door stood open. Inside, the sound hit her first. The flat, unbroken tone of a monitor gone to a straight line. It was louder than it needed to be. It was always louder in her head. Price Logan, someone said the name tight with panic. Unresponsive, no pulse. 2 residents were already at the bed. One straddled a stool doing chest compressions, arms locked, shoulders pumping. The other fumbled with a medication box, plastic vials rattling. A nurse stood at the head of the bed trying to secure an airway. Another hovered by the code card hands, shaking as she loaded a syringe. The heart monitor showed a perfect flat line. No blips, no peaks. A systole. Riley pushed through the cluster. I have it, she said. Heart, get out of the way, one resident snapped. Sweat stood out on his forehead. His compressions had the frantic, uneven rhythm of someone fighting more with his own fear than with the problem in front of him. I am charge on this floor, the nurse at the head of the bed said. We need epinephrine, another line, and the defib ready. It is already ready, the second resident said, grabbing for the paddles. We shock. We have to shock. Riley saw the angle of his hands, the placement on the chest. If you shock like that, you are just cooking his ribs, she said. He glared at her. Do you want to run this code, or do you want to go hand out blankets? He said. She stepped closer to the bed within arm's reach of Logan. His skin was gray around the mouth. His eyes were half-open, pupils blown. The sling and splint on his injured arm made an awkward angle against the linens. Her fingers found the side of his neck, pressing hard against the carotid. No pulse, no movement under the skin. She closed her eyes for half a second. A rooftop, a boy with a wire, a Humvee shuddering around her. She opened her eyes again. The room snapped back into focus. Pause compressions, she said. The resident ignored her, counting under his breath. 17, 18, 19. Pause, she said louder. Do not stop, the other resident barked. We cannot lose perfusion. Riley reached out and caught the compressing resident's wrist mid-push. Stop, she said. He jerked like she had slapped him. You cannot call that, he said. You are a nurse. I am not calling anything, she said. I am changing the plan. She looked at the nurse by the code card. What was his rhythm before the flatline? V-tac, then nothing, the nurse said. He was complaining of chest pressure, then he went out. Riley glanced at the monitor. The flatline stared back. Pads on, she said. Not paddles. Anterior, posterior. What? The resident said. She snapped the defibrillator drawer open, peeled the backing off one adhesive pad, and slapped it against Logan's upper right chest, high enough to clear the dressing and lines. The second pad went beneath his left shoulder blade under his back. So the current actually travels through the heart instead of just across his skin, she said. I know how to place pads, the resident muttered. You were aiming them at his sternum from 3 feet away, she said. You were about to arc him, not shock him. The nurse at the head of the bed stepped aside just enough to give her space. Charge to 200, Riley said. The resident's hand hovered over the controls. We do not shock a systole, he said automatically. That was true 5 minutes ago, she said. He had V-tax before he dropped. He could still be in fine V-fib. The monitor is picking up the chest compressions as noise and smoothing it out. We are going to see what is underneath. She looked at the nurse. On my count, clear except for the pads. No one touching him. Charging, the resident said. His hands trembled on the dial. The machine whined up to 200 joules. The light flashed ready. Clear, Riley said. Her voice cut through the noise with a sharp edge. Hands lifted off the bed. The compressor rocked back. The airway nurse raised her own hands. Riley checked that nothing and no one bridged the circuit. Shock, she said. The resident pressed the button. Logan's body jerked small and contained a brief bow off the mattress. The monitor line flickered, then settled back flat. No change, the resident said. His voice broke on the last word. We should call it. Start compressions again, Riley said. We are not calling anything yet. The stool scraped as the first resident climbed back over Logan's hips and resumed compressions, this time more mechanical, less sure. Medications, Riley said. Dayid. Epinephrine is in, the nurse said, checking the line. First dose. Timer is running. Riley looked at Logan's face. This is not how we lose you, she said, too soft for anyone but herself to hear. In her head, another flat line matched this one. Another patient's skin gone the wrong color. Another set of hands pressing on a chest in a tent where the heat made sweat and blood smell almost the same. She had lost that one. She would not lose this. She reached under the bed and lifted Logan's injured arm, gently supporting it at the elbow. The nurse frowned. What are you doing? She asked. Changing the vector, Riley said. His injured arm is strapped in a way that is blocking conduction. We are going to give the current a cleaner path. You cannot just make up physics, one resident said. I am not, she replied. I am remembering it. She adjusted the angle of his torso, slightly signaling the nurse at the head of the bed to help. Together they shifted him a few centimeters, just enough that the pad on his back sat directly behind the center of his chest, instead of off to the side. Check for rhythm, she said. On the next pause. We are supposed to do 2 minutes between checks, the resident protested. This is not a classroom, she said. The compressor kept counting. 28, 29, 30? Stop, Riley said. Hands lifted. The monitor trembled. For a split second, there was a tiny wiggle in Thies' line, a flicker of electrical activity trying to break free. Then compressions would have smeared it. She pointed. There, she said. It is artifact, the resident said, from moving him. Charge again, she said. 200. This is pointless, he said. She fixed him with a look that made him swallow whatever he was about to add. Charge, she repeated. He turned the dial. The machine climbed. Clear, she said. Everyone backed off. Hands came up. The room held its breath. Shock, she said. The resident hit the button. The current leapt between the pads through Logan's chest. His body jolted. The line on the monitor quivered, then broke into a disorganized scramble. A jagged, chaotic pattern filled the screen. V-fib, the nurse at the monitor said, almost in disbelief. Better than flat, Riley said. Charge again. Slightly higher. They cycled quickly, charge, clear, shock. This time, when the current hit, the chaotic waves narrowed, then resolved into a series of small, regular peaks. Sinus rhythm, slow but there. A soft beep accompanied each one. Heart rate 45 and climbing, the nurse said. We have a pulse, strong carotid. Riley's fingers were still at Logan's neck. She felt it. Faint at first, then more sure under her touch. A small, determined thump. She exhaled a long breath she had not known she was holding. Resume gentle compressions if it dips, she said. Otherwise, let his heart do the work. They watched the monitor for a few seconds that felt like 10 minutes. The line kept its shape. The beeps came slow and steady. Color began to creep back into his lips. His chest rose on its own. Come on, Price, Riley murmured. You did not survive one war to check out in recoveries. His eyelids fluttered. Not much, enough. One of the residents stepped back, sagging against the wall. His face was gray. We almost called it, he said. But we did not, the nurse answered. The code team settled into the calmer part of the protocol. Airways secured, fluids adjusted, orders entered, the noise level dropped. Riley stood very still beside the bed. The world around her buzzed, but it felt thin like a movie played in another room. Under her fingers, Logan's pulse beat on. A movement at the doorway made her look up. A man stood there in a white coat over a dark sweater, hair mostly gray, jaw set. She knew his face from photos and whispered stories. Dr. Howard Briggs, chief of surgery. His eyes went straight to the monitor, then to his son. She did not need anyone to tell her the connection. It was in the way his shoulders dropped as soon as he saw the rhythm on the screen. It was in the way he crossed the space between door and bed in 3 long strides without looking at anyone else. What happened? He asked. His voice was quiet, but there was a roughness in it. Episodes of awe attack that deteriorated to asystole, the nurse at the head of the bed said. Code was called. We had no pulse. Heart-initiated defibrillation with adjusted pad placement and repositioning. We converted to V-fib, then to sinus. Briggs's gaze shifted to Riley. She suddenly wanted to be anywhere else. For a moment, he just looked at her eyes moving over her face, as if fitting it into a puzzle he had not known he was working. You ran the code, he said. We all did, she said. He shook his head slightly. You did something no one else in this room thought to do, he said. You changed the path. You brought him back. There was no accusation in his tone, only a raw gratitude that made it hard to hold his gaze. You did not just save my patient, he said. You saved my son. For a beat, Riley could not make her tongue cooperate. Dr. Briggs stood so close she could see the fine lines at the corners of his eyes and the faint stubble on his jaw. His gaze kept flicking from her face to the pulse ox reading on his son's finger, as if afraid one of them might vanish when he looked away. I could not have done that if the team was not already here, she said finally. He looked at the residents, the nurse, the respiratory therapist. He gave a small nod of recognition in their direction. Then his attention settled back on Riley. They will get their thanks, he said. Right now, I am talking to you. Her spine wanted to straighten at the tone. It had the weight of rank, not military rank, but something close enough that her body remembered how to respond. She let go of Logan's wrist, satisfied that his pulse did not need her fingertips to keep going. Her hand felt strangely light without it. Briggs rested his fingers on the bed rail. The knuckles whitened for a second, then relaxed. When I got the page, he said, it came across as your limb salvage patient is coding. They did not mention he was my kid. Maybe they thought it would make me run faster. Riley did not know what to do with that, so she said nothing. I spent the walk down here rehearsing how to be calm if there was a sheet over his face, he said. How to keep my voice steady while I signed whatever forms people shoved at me. That is the sort of thing you get good at in this job, keeping your voice steady. He pushed out a breath that trembled despite his words. And then I stepped in, he went on, and saw this waveform. He tipped his chin toward the monitor. Logan's heart traced its stubborn line across the screen. I am still catching up, he said quietly. Riley shifted her weight. Her legs felt like she had run much farther than the length of the corridor. I did not do it alone, she said again, because it was the only part she felt safe stating. Maybe not, Briggs said, but you were the one who refused to accept the flat line as an answer. There is a difference between following the protocol to the end and stopping long enough to ask if there is another way through. The residents looked down at their shoes. The nurse fussed with an IV clamp that did not need adjustment. Riley's instinct was to deflect, to redirect the conversation back to lab values or medication schedules. Instead, the words that came out of her surprised even herself. I have seen too many flat lines, she said. Some of them were not as final as they looked. Briggs studied her. Army medic, he said. 2 deployments. That is what your file says. It does not mention that the job followed you home. She did not confirm it. She did not deny it. Logan stirred on the bed. His eyelids fluttered, then opened a fraction. "Dad," he rasped. Briggs turned so fast his coat swung. "I am here," he said. His voice softened in a way Riley had not heard before. "Stay put." Logan managed a thin smile. "You always say that," he murmured. His gaze slid sideways, found Riley. "You again?" he said. It came out almost like a greeting. "Me again," she said. "You keep doing that," he said, "showing up when I am out." "You keep picking dramatic ways to nap," she answered. He huffed a small breath that might have been a laugh if it had not hurt. Briggs watched the exchange with an expression caught between bewildered and grateful. "You can yell at him later," Riley said. "Right now he needs oxygen and time." Briggs nodded. "I am very capable of yelling, and I plan to," he said, but his hand landed gently on Logan's ankle, a touch that grounded more than scolded. The code team began to thin. One resident left to update the chart. Another wheeled the empty crash cart back toward its alcove. The airway nurse adjusted the bed back to a more comfortable angle. Riley stepped away, leaving room for Briggs at the bedside. Her feet felt rooted, then unstuck. As she reached the door, Briggs spoke again. "Hart," he said. She stopped. He did not take his hand off his son's ankle. "Why do you look like I just accused you of a crime?" he asked. She blinked. "Sir, when I said you saved him," he said, "you flinched, like the word did not belong to you." Her fingers tightened on the doorframe. "I did my job," she said. "You did more than that," he said, "and I need you to hear something." She did not step back into the room, but she did not leave either. He looked at his son, then back at her. "You did not just save my son," he said quietly. "You saved me. Whatever nightmare I had rehearsed did not happen because you would not let it." Her throat closed around an answer. He went on softer. "I have signed too many charts that ended with phrases like, 'Despite all efforts,'" he said. "Tonight I get to walk out of here with something different in my chest. That is on you." The monitor beeped behind him, steady and regular. Riley swallowed. "No one ever thanks me for the ones we lose," she said. It was not what she had meant to say, but it came out anyway. "Only for the ones who keep breathing." Briggs nodded slowly. "People like simple narratives," he said. "Alive or dead, success or failure, it is cleaner than the truth." She thought of Ortiz, of folded flags, of reports that turned people into bullet points. Briggs's gaze sharpened. "You are one of the ones who kept breathing," he said. "Do you let anyone thank you for that?" The answer lived in the hollow space behind her ribs. She did not give it voice. He seemed to read it anyway. "Survival is not passive," he said. "It is not something that happens to you while you lie there. It is work. It is ugly and heavy, and it takes more courage than most of us admit." His eyes held hers. "You have been doing that work for a long time," he said, "whether you give yourself credit or not." Riley felt the words settle somewhere she had tried to keep empty. She could have brushed them off, could have pointed at the clock and said she had to get back to her other patients, could have slipped back into the safe, small version of herself that handed out cups of water and stayed away from the center of the room. Instead, she let herself nod once. "Thank you," she said. It was not an acceptance of everything he implied. It was a start. Out in the hallway, the speaker announced visiting hours for a different wing. A stretcher rolled past wheels, rattling in an uneven pattern. "Go," Briggs said, "before someone drags you to another crisis." His tone was almost light. Riley stepped into the hall. The door to Recovery 4 eased shut behind her, the latch clicking with a soft, final sound. The adrenaline in her system had finally begun to ebb. What remained was a tiredness that went deeper than muscle. It felt like the tired that comes after a long march when the ground has stopped shaking, and your brain believes for the moment that the world is not about to explode again. She walked back toward the nurse's station. Dr. Navarro was there, leaning against the counter tablet under one arm. Jen stood beside her, tired eyes alert. "How is he?" Navarro asked. "Alive, Sipor," Riley said. "Hart is back in line. He does not get to skip rehab." Navarro's mouth curved. "I heard some of that code call," she said. "Sounded like you annoyed a few people." "I rearranged some habits," Riley said. "Bolsonaro, so my being Dengistan Yaur." "Good," Navarro replied. "Habit can kill just as efficiently as chaos." Jen raised an eyebrow. "His father showed up, by the way," she said, in case you missed the part where the entire staff suddenly remembered they had something urgent to do in another room. "I met him," Riley said. "And?" Jen asked. "And I did not get fired," Riley said. Navarro snorted softly. If anyone tries to write you up for saving my limb salvage case and the chief of surgery's son in one night, they will have to go through me first." Riley looked at her. "We are going to have to deal with this," Navarro said. "With what you know, with how you learned it, with how we can fold it into what we do without pretending you are just another nurse who wandered in off the street." Riley felt the familiar urge to shrink to duck her head to say it was nothing and that she preferred to stay invisible. Instead, she thought of Ortiz pushing her down, of Logan's arm color seeping back into his fingers, of the monitor in Recovery 4 shifting from a flat scream to a steady beep because she had refused to walk away. The tag at her chest lay warm, now skin heated beneath it. "I am not sure I know how to talk about all of it," she said. "Then we start with the parts that help patients," Navarro said. "The rest will come when it is ready." Jen nudged a stack of charts toward her. "In the meantime," she said, "Bed 7 needs antiemetics, Bed 9's IV is infiltrating, and someone in triage is convinced his headache is a brain tumor. Normal problems, manageable ones." Riley took the charts. The weight of them felt almost comforting. "On it," she said. Hours later, the sky outside the windows began to pale. The snow had stopped. The city lights dimmed one by one as the horizon traded black for a slow gray. The emergency department smelled more like coffee again and less like adrenaline. Riley finished her last chart, signed her name at the bottom, and logged out of the computer. The badge at her chest clicked softly as she unclipped it. On her way to the locker room, she passed the recovery bays. She did not stop. She let the knowledge that he was there breathing be enough. At the end of the corridor, she paused by the window. The reflection in the glass looked almost the same as it had hours before. Same scrub top, same tired eyes, same neat bun. But there were small differences. Her shoulders were not hunched. Her hands were not clenched. The line of her mouth had softened, as if it had let go of something it had been holding between its teeth for too long. She slipped her fingers under the collar of her scrub top and pulled the chain free. The dog tag swung into view, dull metal with scratches across the surface letters, worn but still legible. Ortiz Miguel. She pressed her thumb over his name. "I am still here," she said quietly. The glass gave back only her reflection and the early light. She tucked the tag back against her skin, not to hide it, but to keep it close. Behind her, the emergency department stirred to the rhythm of the morning shift. Phones rang. Someone laughed at something that was not really funny. A monitor beeped in a room she could not see. Riley turned away from the window and walked back toward the sound. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.